Hello and good day to you, it's Talkin really, and today's story is in Disability News Service, DNS, and the story goes that talking about virus, disabled people must not be seen as inevitable cannon fodder. So the outcome of this is the DNS story. Virus. Disabled people must not be seen as inevitable cannon fodder. Disabled people are beginning to raise grave concerns about the potential impact of virus on people with long-term health conditions and high support needs, particularly those who employ their own personal assistants. So this story continues. The Department for Health and Social Care, DHSC, published its action plan on dealing with the virus this week, but the document said very little about social care. Health and Social Care Secretary Matt Hancock said, "Protecting the most vulnerable is our absolute priority." He added, "We all have a role to play in combating this threat, and I urge everyone to take stock of the simple methods that offer the best protection. Right now, that means making sure you are washing your hands properly and regularly and always following the most current public health and travel advice as it develops." The government said that it was currently focusing on containing the spread of the virus, but the action plan states that if the virus becomes established, the focus will be on providing essential services, helping those most at risk to access the right treatment. The DHSC said yesterday, Wednesday, the 11th of March, that it would publish guidance for the care sector shortly, but there are concerns that this could focus on the care industry and residential homes rather than disabled people who employ their own personal assistants, PAs. The Local Government Association said this week that councils were working alongside Public Health England, the NHS and other organisations to assess a risk, provide advice to communities and try to prevent the virus spreading further, and that local plans were in place for every eventuality, including a pandemic. Few, if any, disabled people's organisations have spoken out yet about the impact of, but some disabled people and DPOs have begun to express concerns. Disability Rights UK, DRUK, is one of the first to speak out. The UK Chief Exec told DNS that disabled people should not be seen as inevitable cannon fodder in the face of when it was those with underlying health conditions who appear to be bearing the brunt of the worst effects of this illness. He said that DRUK was seeking evidence that hospitals would be able to cope with the most vulnerable cases in the event of mass infection. He added, "Our lives matters as much as the next person's." They called on the government to make extra funding available in the next week's budget to allow for extra social care that would inevitably be needed for disabled people should the epidemic take hold. He also warned that self-isolation in the event of infection with the virus was not as easy for many disabled people as it might be for non-disabled people. He said, "We would ask that those responsible for planning in social care and hospitals understand and provide for that fact. If self-isolating, not everybody can be alone." He said adequate provision would be needed for those who cannot self-isolate alone, including those who need full-time assistance, support with eating, drinking and mobilising. But he also said that people whose immunity was compromised should already be well versed in hygiene routines, including asking people with any symptoms of any virus to stay away and practicing good hand washing hygiene. He said, "As far as we can tell at this stage, The same procedures apply for 19. Mark Williams of Bristol Reclaiming Independent Living said, "As a disabled employer, I am concerned about my staff and their capability of supporting me to carry on living independently. It's all very well for the government to tell people to self-isolate or work from home, but there is no advice for people in my situation and how it might affect me." Even at Prime Minister's questions this week, when asked about his social care plans, Boris Johnson talked about elderly people being able to keep their homes, nothing about how it would affect working age disabled people. Therefore, why should he think about how virus might affect us? Disabled activist Brian Hilton called for a thought-through response that protects both residents and staff within care homes and other residential settings. Similarly, disabled people who live independently with the supported care staff need some reassurance that support will be available if required. He called for government statement on what support, contingencies and resources would be available to disabled people if the situation worsened. Right, well, there you go. That's the story for today. Hope you enjoyed it. Don't forget you can click the button down below, like and share, and don't forget to come back again for another story. Bye for now.